It's an honor and a pleasure to welcome Raymond Dutch to this edition of the Bogota Experimental Economics Conference. Ray is an official fellow at the Nuffield College in Oxford, and he is the director of the Nuffield Center for Experimental Social Sciences, CES. CES has centers in Oxford, Santiago de Chile, and in Nankai, China. Prior to Oxford, Ray was the Senator Don Henderson Scholar in Political Science at the University of Houston. He received his BA with honors from the University of Manitoba in Canada and his MA and PhD from the University of Rochester. Professor Dutch's research focuses on responsibility attribution, incorporating elements of theory, experiments, and analysis of public opinion. More recently, Ray has turned to experiments in order to identify the information shortcuts that individuals deploy for attributing responsibility for collective decision-making. He has conducted lab, field, and online experiments in a variety of different countries in order to identify these information shortcuts. Ray has held visiting positions at the University Pompeu Fabra, Stanford University, the Institute for Social Research Oslo, the Université de Montréal, and the Science Center for Social Research in Berlin. And he is currently the long-term visiting professor at the Institute for Advanced Studies at the Toulouse School of Economics. Ray has served as associate editor of the American Journal of Political Science and the Journal of Experimental Political Science. He is also one of the founders of the European Political Science Association and the International Meeting on Behavioral Science, IMEBES. And he is currently vice president of the Midwest Political Science Association. So after this short summary of Ray's accomplishments, it's for me an honor to give it to you, Raymond Dutch. So Ray, you have 1 hour for your talk, and then I will moderate questions from the audience.
Great, thank you very much, Cesar. And please interrupt at any point. I will share my screen, maybe.
Yes.
Yep. Maybe start at the beginning. Can everybody see that? You can see it?
Yes, we can see it.
Cool. Good, great. Okay, well, thank you very much, Cesar, for that very nice introduction, and mostly, and even more importantly, thank you guys for inviting me to speak today. It's a real pleasure and honor. It's too bad I'm not in Bogota, but this is a good second best. I'm going to talk about a variety, basically my current research, which is a bit eclectic, a little bit exotic. And as I go through, if you have any questions, you really should stop me and ask for clarifications. The talk will focus on three things. Three things recently that I wanted to know. One of them is the upper left picture, which is really the impact or effect of the recent COVID on economic preferences. The upper right is understanding a little bit about preferences regarding vaccine allocation. And I'll focus, I think, on those two things primarily. And the third is something I've been working on over a number of years, is predicting elections. And I'll talk a little bit, maybe, if I have time at the end, about my fairly exotic strategy for predicting the Trump-Biden presidential election campaign. The idea behind this presentation is to provide a little bit of insight into the substance that I've been looking at, but also provide some sort of reflection maybe on methods or the way we approach doing research regarding economic preferences in economics and political science. So I'll focus on these three things as an illustration. And one thing which I think is quite important here is understanding a little bit about why we want to know these things. And that I think is important because it's sort of the foundation for the sort of methodological stuff I'll be talking about. So why do we want to know the impact, for example, of COVID-19 shocks on economic preferences? Well, in a sort of cynical world, one reason is because we think, in the upper left-hand corner, we think that these shocks to economic preferences could in fact affect economic behavior. And if we're right, then we ought to be able to take advantage of that. In my own sort of cynical fashion, I've been working with insurance companies trying to understand how the differential effect of COVID-19 has impacted the behavior of consumers regarding insurance and the purchase of insurance products. The upper right-hand corner basically suggests that why are we interested in understanding vaccine allocations and economic preferences or economic attitudes toward vaccine allocations? Well, we want to understand that because healthcare providers are very interested in this, because they're concerned that the vaccine allocation strategies adopted by government authorities may not coincide with the expectations of the recipients of these vaccine allocations. And if that's the case, then there's going to be a problem in terms of implementing these vaccine allocation strategies around the world. And so we've also been working with healthcare providers, providing them with information about how public attitudes towards allocation strategies affects receptivity towards COVID-19 vaccines. The third interest, as I pointed out, that I'll talk a little bit about today, maybe if we have time at the end, is predicting elections. And I have a very, if I get to it, I have a very sort of exotic strategy for election predictions, but one that I've worked on both in the US and in the UK. And what is the economic interest in election predictions? Well, hedge funds are very interested in understanding and predicting on a day-by-day basis shifts in voter preferences just prior to the election, because that, of course, affects currency fluctuations. And one of the groups that I've worked with over the last couple of years, both looking at UK elections and looking at US elections, is hedge funds, because hedge funds are very interested in novel approaches to predicting voter behavior, particularly just prior to elections. So the whole point here is that we study political and economic preferences because we think it affects behavior, and there are lots of both economic and political actors out there who are very interested and have basically a financial interest in understanding these outcomes. So hopefully I'll provide some insight on these three substantive areas in the talk. So the broad theme is I'm going to look at or focus on economic or quasi-economic preferences. And I'm interested in designing experiments that allow us to understand these preferences. Do they matter? And in particularly, do they matter? Are they stable? And when and why do they change? So I'm going to hopefully convince you that the sort of research apparatus that I've been assembling for answering these questions is rigorous and informative. And I'm going to focus basically on this sort of this research approach. I'm going to talk a little bit about how recent innovations in data collection, modeling, and machine learning help us better understand these preferences. There's three challenges I'm going to talk about that I've been dealing with, at least in my research. One is better understanding the consequences of these preferences and the consequences of our conjectures about what affects those preferences, right? So does it matter that, for example, risk preferences are affected by health shocks like COVID, right? Does it matter that that we're able, for example, as Christina was pointing out yesterday, does it matter that we can nudge consumers or citizens by appealing to certain normative values or providing them with empirical information, right? So consequence, I think, is a very important issue. And the second one is heterogeneity, that I've been sort of spending a lot of time thinking about. And the third, if I get to it, the third theme that I've been spending a lot of time looking at is how can we approach or better measure or better calibrate preferences in unobtrusive in an unobtrusive fashion, right? Most of the stuff that I've done over the course of my career has been obtrusive, right? Designing lab experiments, doing online experiments with large N subjects. But I'm going to sort of suggest some direction that we might think about taking in order to sort of make these calibrations more unobtrusive. So the issue of consequences, right? So does the fact that we were able to measure or identify an average treatment effect matter, right? And that's an important, obviously I'm not the only one to raise this issue, right? I mean, it's a real important question and a real important challenge, I think. Most of the experiments we do, and I've done, right, are based on convenient samples. So the estimated treatment effects are virtually always non-representative, right? This is the case for lab experiments. It's the case, in spite of what many people claim, for RCTs and field experiments. You know, oftentimes people find very interesting identification strategies that are based on various kinds of discontinuities. But these typically, almost inevitably, are again not representative. And online survey experiments were very popular, particularly in political science, but I can see also in economics. They're also inevitably based on a non-representative sample, in spite of what many people might claim. So there's really typically, with many of these ATEs or these experimental results, there's no credible evidence that the treatment effects generalize. But that, you know, I'm sure that's not news to most of you. But that's one of the the sort of areas that I've been trying to sort of tackle in the research I've been doing. The second one is heterogeneity. Basically the importance of estimating conditional average treatment effects, right? Conditional average treatment effects matter. They're often not similar to or not equal to average treatment effects. They can be, but they're often not. And so one of the things I've been sort of focusing a lot in my research is figuring out which conditional average treatment effects matter. And that's not that trivial, actually. And how would you know whether you had a conditional average treatment effect if you're, for example, only using a very small restricted a data set? So I'm going to try to convince you that I've sort of have some marginally interesting insights into heterogeneity and thinking about CATs. So that's the second point. And then the third point is calibrating unobtrusively individuals' preferences and behavior. And the third area that I've been working a lot on is what I call digital trace, which is observing in an unobtrusive fashion digital footprints. And these are digital footprints, obviously, are activity, conversations, behavior in social media or on the internet. And in many respects, these are real revealed preferences. And I would argue that these are better reflection of individuals' underlying preferences. And increasingly, most people are somehow engaged on social media or in a digital fashion. The challenge, I think, for us is figuring out how to sort of combine this digital trace or these digital footprints with random assignment of treatments in order to sort of be able to test interesting conjectures about preferences and behavior. So those are the three sort of dimensions of my research that I'll emphasize over the course of the talk. So I'm going to start by talking and illustrating these themes with some work that I've been doing with Peiran Jiao, who's at Maastricht, and Tom Robinson, who's currently at Durham. And these are former students, postdocs at Oxford. And this project, COVID-19 and Economic Preferences, is a project that emerged immediately after the outbreak of the COVID-19 pandemic. And when the pandemic emerged, Peiran and myself and Tom thought this would be a good opportunity to try to estimate the relationship between local COVID infection shocks and economic preferences. And the economic preferences here of interest initially were risk, patience, and altruism. And the motivation here behind this project is a fairly extensive literature that looks at the relationship between various kinds of trauma or traumatic events and economic preferences. So wars, violence, hurricanes, tsunamis, etc. There's a fairly extensive literature examining the relationship between these events, right, and economic preferences. The evidence, though, is fairly mixed. I mean, people, the published data in this area actually, and sometimes can be entirely, the signed relationship between these events and economic preferences can be different depending on the study. So there's a tremendous amount of heterogeneity in terms of the correlations between these events and economic preferences, like risk preferences. Now, part of that is simply that these tend to be fairly isolated events, like a hurricane in Houston, or a tsunami in Japan, or election violence in in Africa, or wars in Afghanistan. So these tend to be fairly sort of narrow, possibly context-specific events, and that might explain the heterogeneity in terms of the correlation with economic preferences. Our initial conjecture was that the COVID-19 pandemic, in some sense, would be a very interesting traumatic event to examine, because by March, when we started doing the research, it was clear this was going to be fairly pervasive, and we thought we could explore these shocks in very different national contexts and get some leverage from the diversity of these national contexts in terms of understanding the heterogeneity of this health effect. So what we did is we decided we would look specifically at the impact of local infection rates. We characterize this as a treatment. The impact of these local infection rates on economic preferences. This is Italy is one of the cases in our study. And what's really interesting about Italy is the dramatic explosion of the COVID-19 infections over the course of literally a month, right? So this is a situation in which the local shock was quite dramatic. And I think we all will have remembered or recall the media attention that this received. Now, what's important in this project is it's very narrow. We're only interested in the local shock of infection rates. Obviously, there's other things going on, right? There's national media, there's international media. All of these things undoubtedly affected people's preferences or people's beliefs. But what we try to do in this particular project is focus specifically on the impact of local shock on economic preferences. And we leverage the fact that even in Italy, even though the country as a whole experienced a dramatic increase in infections, the diversity across regions and across local communities was quite dramatic. And the goal of this project was to leverage this diversity to measure the impact of the shock on economic preferences. So the design is essentially, we selected from each of these countries a sample of local regions. In Italy, it was provinces. In Chile, it was comunas, and in China, it was basically cities, city/provinces that they call them. And we sampled, this is the sample we used. We sampled a diverse group of communities in all 3 countries to try to sort of make sure that we had a very significant range between high infection to virtually no infection. And that is basically the treatment that we use or in order to model the impact of these shocks on economic preferences. What we did is in each of these 3 countries, we within each of these communities, we randomly selected respondents and administered online surveys that measured a variety of economic preferences in Chile, China, and Italy. And here we have the results of the basically the regression of these risk preferences. This is the GPS risk preference, which is the staircase method, which is in the Falk et al. Piece, which uses this metric that ranges between 0 and I think 32, right? And here we're simply looking at the relationship between some covariate controls, age, gender, and education. Also a control for the community GDP level, and then what we're calling our treatment effect, which is infection rates. And the relationship between the infection rate and risk preferences is very strong in China and very strong in the pool sample, but pretty non-significant in Chile and Italy. We did the same regression with the GPS patient measure, which again is the same staircase measure of patients. And again, and now in this case, we actually have a significant positive relationship in China and Italy, not in Chile, and not in the pool sample. So the punchline of these initial regressions is that there's some reasonable evidence for a relationship between these economic shocks and economic preferences. The relationship varies across context, which is not inconsistent with what the current literature suggests. The impact of infection rates is in the expected direction. So high levels of infection rates, more patients, high levels of infection rates, more risk aversion. This was the sort of starting point for the analysis. My next question was, not surprisingly, given what I pointed out at the beginning of the talk, my next question was, well, do we have heterogeneous treatment effects here? We have a large sample, we have a very diverse sample, right? So we have altogether about 3,000 observations. Is there heterogeneity in terms of the relationship between these infection rates and economic preferences? And at this point in the data analysis, I of course turned to work that I've been doing on heterogeneity and suggest that we use this machine learning strategy for estimating the conditional average treatment effect. So I have a number of papers where that I recently published arguing that employing machine learning strategies for estimating conditional average treatment effects is an optimal strategy for identifying whether we have heterogeneity in terms of these estimated treatment effects. And the reason is because these are modeling strategies that are that impose no prior functional form to the estimation of the heterogeneity. And the intuition here is that, well, there are a variety of possible interactions that might be generating heterogeneity in the treatment effect. And the optimal strategy here for, and typically we don't know what those are, right? And we don't have any strong theoretical priors. So an appropriate modeling strategy here is one in which you impose no a priori functional forms on the estimation of the conditional average treatment effect, and you use a machine learning strategy for identifying in an optimal strategy the conditional average treatment effects that matter. So Bart is one of these strategies, and what it essentially does is that it uses a standard, almost a cart, right, estimation strategy, a tree strategy, in which you're simply identifying optimal ways to categorize outcomes. And what Bart does is essentially generates for each observation, each unique combination of covariates. It identifies an outcome in control and an outcome in treatment, right, for that unique combination of covariates, right? And the difference between that predicted outcome in treatment and predicted outcome in control for that unique combination of covariates is a conditional average treatment effect. So if, let's say, in my case, I had 2,500 unique combination of covariates in the data set, Bart would generate a conditional average treatment effect for each of those unique combination of covariates in the data set. So you would have a conditional average treatment effect for every possible covariate combination in the data. And that I at least have found that to be an attractive way to identify salient conditional average treatment effects or salient heterogeneity in the data. So here's a picture of the result. And this is a standard Bart estimation. And what this does is, if you look at the top of the figure, on the left-hand side for risk, it identifies the average treatment effect, which is the blue line. And that's the average treatment effect for risk. And then on the right-hand side, it has identified the average treatment effect for patients for the entire sample, which is the ATE on the blue line on the upper right-hand side of the figure. And what it does is it simply organizes from left to right all of the conditional average treatment effects for your data. So in this case, it's organized the conditional average treatment effects starting at about minus, one of my glasses on, so it's starting at about minus 1.5. And then you see the top treatment effect as being 0.05. And so all of the cases are simply organized along that horizontal axis. And then you can see then on the lower plot indicates the density of the low education and high education respondents. So the red is the high education and the blue is the low education. So what the colored histogram or colored plot on the bottom left suggests is that the conditional average treatment effects along that horizontal axis are reasonably are similarly divided amongst high and low education people. There's no evidence of heterogeneity, at least with respect to risk. Patients is a different story. So if you look at the patients plot, what it suggests is that most of the low education people are on the right-hand side, and more of the high education people are on the left-hand side. And what this suggests, since the treatment effect is positive, what this suggests is that there seems to be heterogeneity in terms of the treatment effect for patients. So more of the it seems it's in the case of patients, it seems that the treatment effect on patients tends to be more concentrated amongst lower educated subjects. And in fact, when we run this analysis for most of the economic preferences in the data, we find that most of the treatment effects for most of the treatment effects, the treatment effects tends to be observed amongst low educated respondents, and the higher educated respondents tend not to be affected by these local health shocks. So the COVID awareness or the infection shock clearly tends to be focused amongst the low educated. It's also the case, although I don't show it here, we also looked at people's awareness of the COVID-19 infections and people's compliance with regulated COVID-19 regulations. And again, what we find is that the awareness and compliance conditional average treatment effects tend to be much greater for low educated respondents, and we don't tend to see significant conditional average treatment effects for the low educated. So the punchline from this analysis of heterogeneity is that yes, there is an average treatment effect, as we saw here. There is an average treatment effect for risk for the sample as a whole, and there is an average treatment effect for patients. But in fact, the treatment effect tends to be much more observed amongst low educated and tends to be much less observed amongst the better educated. And the takeaway that we have from this analysis is that infection signals or local infection signals tend to inform low educated residents, and local infection signals tend to have little impact on better educated residents in these communities. Now there's a whole range of possible explanations here. One of them that I think is plausible is that better educated residents in these pandemics tend to be much more attentive to global and national information, and that tends to much more inform their preferences and awareness levels than local infection shocks. But the takeaway here is that local infection shocks matter, but they tend to be primarily important for less educated subjects. Now, that's the heterogeneity. And I think we have an interesting heterogeneity result. The third, or the other element that I've been focusing on in a lot of this research is, does it matter? Is this infection shock of any consequence? And increasingly in the work that I'm doing, I try to sort of combine the estimation of these experimental treatment effects with a strategy for determining whether they matter. Does it matter that I, was able to estimate this, regression coefficient of 0.05 in China and 0.02 in Italy, right? And what's important to note is that, again, this is a convenience sample, right? I mean, yes, I've identified communities that that had high and medium and low infection rates, but the bottom line is that both those communities are a result of a convenience sample, and the individuals who are sampled within those communities are a convenience sample, right? And I would argue that virtually all research nowadays, even some of the best survey research, is essentially a convenience sample. Nobody does a representative sample of the population anymore. But I would argue that irrespective of the fact that these are convenience samples, you can design estimation strategies that'll allow you to say something about the overall population and the overall consequence of that particularly estimated treatment effect. And in order to do that, I in any case have been employing a small area estimation, and I try to implement this with most of the experimental research that I do. And what is small area estimation? Well, in political science, where it's used a lot, or has become recently quite popular, is basically MRP, which is a multiple regression with post-stratification, right? And the small area estimation involves three things, right? You have to have an experiment training data, which is the data that I just described, right? That estimates these individual level results, that allow for correlating these demographic profiles with decisions or treatment effects, right? So I have this experimental training data. We have measures of gender, education, age, and we have an estimated treatment effect, right? Or choice decisions. A critical second element is to have a stratification frame. And basically, and that's essentially an enumeration of all of the individuals who fall within a particular demographic profile of the population, right? So it is mutually exclusive and exhaustive, right? And I'll show you a little example. And then you need to have a strategy for mapping these estimated treatment effects to each of the cells in your stratification frame. And that's what I did in the Italian case, right? So in the Italian case, what I did was I had, for all of the provinces in Italy, I was able to identify the population that for any particular province, I was able to identify the mutually exclusive categories of gender, age, and education, right? So I knew sort of, for example, for Bergamo, how many women were in the 18 to 25-year-old category who were high educated, right? This is actually not the census estimate, but this is an estimate from the Italian labor mobility survey, right? But what it does, it's large enough, so it tells me that this is the relative weight of female 18 to 25-year-olds who are highly educated, who are in Bergamo, right? And I know Bergamo falls in the, actually, in the high, medium, it says medium, but I think it should be high, infection category, and falls in this GDP range, right? And with all of that information, and I have this for all of the provinces in Italy, so I have a complete stratification frame for Italy, and using that complete stratification frame, I'm able to use a simple multi-level model, right, to predict for every individual in Italy their response, for example, their risk preferences or patients, right, as a function of their gender, age, education, and also the GDP level and the infection level of their province. So this provides a complete forecast of risk preferences for all of the provinces in Italy. And so I'm able to populate all of these cells with an estimated, for example, an estimated risk preference or an estimated patient's preference based on the online survey data that I analyzed previously. So what that gives us in the end is a complete mapping of, for example, on the left-hand side, a complete mapping of preferences, patient preferences in all of the Italian provinces, right? So I know, for example, the left-hand side, the open dot here is without an infection shock, and the filled-in dot is with an infection shock. So this suggests, for example, in Bergamo, if you go down here, it suggests that, in fact, patients increased quite dramatically, right, pre to post COVID. And this provides a complete profile of the impact of the COVID-19 local shock in March. Remember, this is only March and April that I'm measuring here. So at the very early part of the pandemic. So this provides a complete profile of the impact of this infection shock on economic preferences throughout the country, throughout the Italian country by province, right? So in my opinion, this is what we should be trying to estimate when we conduct experiments, right? We ought to be thinking about trying to map the entire or the estimated treatment effect to the entire profile of individuals within a particular population. This is what people, I think, would find useful and interesting, right? Me conducting an online survey and estimating a coefficient of 0.05 in Chile or in China for patients is not particularly interesting or useful, right? So the punchline, I guess, that I'm sort of advocating here is really when we conduct these experiments, we ought to be thinking about an experiment training data set. We ought to be thinking about a stratification frame that we can map these experimental treatment effects to, and we should be thinking about a learning algorithm that basically maps our experimental treatment effects to a complete stratification frame so that we can say something about the overall impact of a treatment effect on a particular population. And a thing to note here, and this is something I've worked on fairly extensively, you can do this, you can generate this overall picture with quite unrepresentative data, right? So samples. So you don't have to have a very expensive probability sample of Italy in order to do this, right? You can actually have a pretty unrepresentative convenience sample, but at the same time get pretty robust estimates of the treatment effect for the entire population. So that's my, or that's an illustration of what I think, the direction that I think we should be going in terms of both ensuring that the estimated treatment effects we generate actually map to a population so that we can say something, I think, useful about the generalizability of a particular experimental result. Okay, so I've sort of used up most of my time, I can see. And I'd like to briefly talk about a second project that I've been working on, COVID-19 project, that also very much relies on estimations of heterogeneity in treatment effects. And I've been working on, along with a number of other people, some of them here, a project looking at public attitudes and public preferences regarding the COVID-19 vaccine allocation. And I'm going to very briefly, since I have about 5 minutes, I'll basically summarize the project quickly. And this is a project that was conducted in 15 different countries, including Colombia. And the experimental component of this is a conjoint experiment that was embedded in these surveys conducted in 15 countries. And the conjoint experiment basically consisted of, it's a discrete choice experiment in which individuals are presented with profiles of potential vaccine recipients, and they are asked to choose between a person A and a person B in terms of who should get the vaccine immediately. And the attributes vary in terms of the risk of a COVID-19 related death. So it could be high, medium, or low. The risk of catching and transmitting the COVID virus. Again, it could be average, above average, or high. The income level of the individual, again, could be average or above average. Occupational status, there's a range of occupations that these individuals could have, and they could be either young or old. So the conjoint basically randomly assigns attributes to these people, right? So, and that's, and we leverage the random assignment of these attributes to these individuals in order to estimate which of these features are most salient in terms of who should get the vaccine immediately. And the estimation is very simple. All we do is regress the choices on dummy variables for all of these different attributes, and the coefficients on those attributes then give us a sense of how important the importance individuals associated with different features of individuals in terms of the vaccine allocation. And these are the results, which you probably can't see, but I'll just sort of summarize them. So there's 4 regions. There's Asia, Africa, Europe, North America, and South America. And our countries are all organized in these different regions. And if we look here, we can see the importance of these different attributes. So this is the importance of the age. So clearly, in most countries, as people got older, as the candidates for the vaccines became older, individuals were more likely to select them. Income didn't matter much except for South America, basically Chile, Brazil, and Colombia. So there's some evidence in South America, for example, that if the recipients were high income, that they would be favored by the respondents in the survey. But we really don't see much of that elsewhere. A little bit. This is Canada, I think. And then clearly, individuals felt that key workers, most key workers, should get priority in terms of the vaccine. And there's clearly individuals thought that high risk of transmission or high risk of death, those characteristics favored vaccine allocation. The punchline of this research really, and this is I think the interesting result, is that there's global consensus on vaccine allocation. And that, in my view, suggests that generally vaccine allocation is considered a public good by most of the population. And this we found surprising. So this is basically 15 different countries, 15,000 respondents, making about 120,000 decisions. And it's quite clear that throughout the world, there's this clear consensus on the types of people who should receive the COVID-19 vaccine. So, and this was one of the conjectures that we were testing in this particular project, right? Is there a homogeneity in terms of allocation preferences, or is there heterogeneity? And certainly this result suggests homogeneity. It's also the case that I'm not going to sort of go into all the estimation here, but this is again a Bart estimation. So basically what I've done is I've taken all of these data and I said, let's use a machine learning strategy to see whether there's heterogeneity within these populations. So, for example, is there some, in this case, is there some evidence that higher versus low educated people make different allocation priority decisions? There's a little bit of evidence in this case, without going in great detail on how we estimated. There's some evidence here that middle educated individuals were more likely to favor older recipients. On gender, there's, without again going into detail on the estimation, but there's some evidence that women are more favorable towards key workers, but it's not dramatic. And there's very little evidence that age matters. So in other words, it's not the case that, you know, young people were indifferent about giving the vaccine to old people, and old people were indifferent about giving vaccines to younger people. So the punchline here was that there was little heterogeneity. We also asked whether people prefer government versus private allocation of the vaccine, and there was overwhelming consensus across the globe that these allocations should be public rather than private. So we gained some insights here into vaccine allocation preferences, global consensus. I spent a lot of time thinking about heterogeneity here, but heterogeneity doesn't seem to really, doesn't matter dramatically. And there seems to be a global consensus on government provision. And I think the vaccine allocation, I think we can think about generally populations as perceiving vaccine allocation as being as other regarding as opposed to self-interested. Cesar, I think I'm done, right?
Yes, you have 1 minute left if you want to wrap up or provide any final insight.
Okay, I'll take 1 minute to wrap up with my Twitter and Mturk prediction on the Trump-Biden campaign. So basically what's interesting about election campaigns is that I've used the same estimation strategy, a data set that generates individual level predictions, and that those individual level predictions are all based, none of them are based on surveys. They're all based on machine learning analyses of Twitter conversations and Mturk analyses, Mturk preferences and Mturk analyses of Twitter conversations. So so the predictions are all based on a combination of the Twitter API and Mturk assessments of these Twitter conversations. And we use machine learning to basically estimate an individual level model that allowed us to predict the percentage of votes that Biden and Trump would get in each of the US states. So no public opinion polling, only using social media and machine learning along with some crowdsourcing. And what we did is we generated these predictions using these data that we collected. We then, as I pointed out in the earlier example, we then projected these individual estimates to a stratification frame, which consisted basically of voter files, which are giant in the United States, and the American Community Survey. And we then basically summarized, added up the predicted votes in each of the states, and then came up with the Trump-Biden winner in each of those states. And this just compares us to 538. And we're the red, 538's the blue, but there's our, this was published prior to the election. we were a little bit off, but not dramatically. So we predicted 199 electoral votes for Trump and 339 electoral votes for Biden. So a little bit inflated for Biden, but nonetheless, the interesting thing about this research project is that we use the same methodology that I'm using for generalizing experimental results, but the attraction of doing this in the electoral context is there's a result. So our predictions can be basically lined up against a real set of outcomes. It's a little bit more difficult, obviously, in the case of the COVID-19 and economic preferences. We don't have an actual benchmark for the patients and risk preferences to benchmark against. But in these election campaigns, there is one, and we're either correct or we're wrong. So I'll wrap up with that. Thanks, Edward.
Thank you, Ray. So I will just move immediately to the questions. So if you have any questions, you can directly write it into the chat and I will pass it to Ray. So Ray, there is already one question and it refers to the first part of your talk. And Sven Gruner asked, is your hypothesis to observe short-term changes of risk preferences, for example, or do you assume that experiences of COVID change people on the medium term too?
Very good question. So this is very short term in the sense that we conducted these surveys in March and April, right? So we know what the outcomes, we know what the very short term outcome responses were to local shocks. That's all we can say. And what's even more what's important here also to understand is that we can't say anything about the overall effect of the COVID-19 shock on economic preferences, because clearly, undoubtedly, the national and the global coverage of the pandemic have also affected preferences, right? So all we try to do here, and it's a very modest effort, is to try to isolate the very short-term effect of these shocks on preferences. Now,
thank you, Ray. So there is one more question. There is one question from Francesco Oliacino, and he's asking, what do you think is the mechanism that goes from the shock to the preferences?
That's another very good question. I don't know. My sort of conjecture here is that if you are in Bergamo, for example, right, in the local community, right, you are seeing on a daily, you are experiencing on a daily basis lots of deaths, an overwhelmed health facilities, right? The other thing we do, which I did not present here, is and as part of the paper, is we have a series of questions asking people whether they were aware of various intensity measures of COVID. In other words, were they aware of deaths or were they aware of infections? And also we asked them a series of questions about behavior, whether they wore masks and all this other stuff. And it's clear that we get exactly the same results. So the people in the high density communities are all high intensity communities are also communities in which people are much more likely to say that they knew somebody who died or knew that the infection cases were high or but also they wore masks or they didn't allow their kids to go to school. So there's clearly part of the mechanism is that they become aware of the seriousness of the shock, and we document that, right? But I think I can't answer the question about what is the actual cognitive mechanism, right? Is it because they become they're afraid of death, or whether they think that they're going to lose their jobs so that they become more risk averse, or do they become more other regarding because they're more dependent on people around them? So I don't know that detail of the mechanism, and I think that's a good question. It would be interesting to see or to understand that.
Thank you, Ray. So let me continue with Santiago Alonso's question. He's asking, regarding heterogeneity, did you observe stronger effects on economic preferences on those who actually got COVID?
No, we don't. I didn't look at that actually. I don't even know whether we asked that question. We clearly asked whether people knew people who had, contracted or had died, but I don't think we asked them whether they had contracted COVID. And I'm not even sure our ethical approval board would allow us to do that. But we didn't ask that. So it's a good question. It's
And there is one question from Juan Camilo. So he is intrigued in the choice experiment on the effect of assigning the vaccine to different income groups. If he recalls correctly, only in Latin America there was an effect by income level, but the graph seemed to suggest a negative effect. That is, richer people should be less eligible to get the vaccine. So it's partly a clarification question, but it also sounds to me as an interesting point, and is it clear, or is this a suggestion of your results that here in Latin America, probably the region with largest inequality within your respondents, maybe people think that richer people should be less eligible then?
Yes, that's clearly the case. So yeah, if you look at the slide, it's clearly that in the South America, I mean, and it's in all three countries, there's an indication that the higher income individuals should be less preferred in terms of the vaccine allocations. Yes, there's no, and this is interesting because this is not weighted data. So we don't get as many low-income respondents as we should. So in other words, this is not simply self-interest, right? I mean, it's almost as if there's some redistributive preference being sort of expressed here, right? But what's interesting is it doesn't happen in Europe, clearly. I mean, Europe, zero. And it does, there's a little bit of an indication that it happens in both the US and Canada, but no, it's not strong. Which is interesting. So you're right. I mean, it may be clearly the countries with the most inequality, like the US and Latin America, are the ones in which there's a preference against high income recipients. Now, I have some theories about this, but I may be wrong.
Thank you, Ray. So I will close with two final questions. So one from the backstage. So Santiago Sautua asks if you know any research combining structural models of behavior with big data techniques to make out of sample predictions?
Do I know? So I don't know a lot, to be honest. I actually don't think it's very popular yet, or particularly in economics, right? I mean, in political science, it's very popular for election forecasting. No one does election forecasting anymore that doesn't do I mean, no one. I should sort of qualify that. It's very popular to do now this kind of estimation about political behavior that combines big data and structural models to do out of sample forecasts. In economics, I think it's less popular. I think it's becoming more popular in medicine. So I think people now design RCTs in medicine with an explicit goal of trying to understand what the treatment effects look like for the whole population. So I think increasingly people are thinking about stratification frames and thinking about estimating these treatment effects for a very heterogeneous total population, right? I think that that's increasingly the case.
Thank you, Ray. So let me close by saying a big thank you for you for attending and for presenting us this. This was a very nice talk in which you combine some insights on new methodological features with very relevant questions for this moment. And then I will just close with one final question, which is related to this. So one of the assistants is asking if you can elaborate more on how the choice of convenient samples can help in drawing insights across the entire population.
Very good question. So and this is what motivated the research in the beginning, there's a very famous study that was done about 6 or 7 years ago that, or 8 years ago, maybe by now, Andrew Gelman was involved in it at Columbia, and they took a very, very unrepresentative convenience sample of gamers, and but very large, but very unrepresentative sample, and were able to successfully predict the election results. I think in the it would have been in the last Obama election, I think. But the punchline of that was you could have very unrepresentative samples as long as they're large enough, right? And as long as you're able to map them to a stratification frame and generate very reliable predictions. And so in my case, for the Trump election, Trump-Biden, the sample was Mturk, which is very unrepresentative, and Twitter conversations, which are very unrepresentative, right? And in spite of that, I was able to map them to a stratification frame and come up with predictions that looked very much like 538, which was based on, an amalgam of so-called representative samples. So they can be extremely, as long as they're large, they can be, and they can be quite unrepresentative and still generate precise predictions.
Okay, so thank you, Ray, and thank you all of you for attending this keynote talk. I hope it has been as nice for you as it was for me. And okay, so let's see each other in the contributed sessions starting in 10 minutes in the corresponding Zoom link. So if you want, I can put here also the Zoom link in case you are planning to attend the following sessions. So thank you, Ray. And
thank you, everybody, for your great comments. I appreciate it.
Thanks a lot, Ray. That was